As part of primary care networks, TSL Community Anchors are uniquely placed to support and encourage new community activity that helps health colleagues tackle local health priorities.
From working in this sector for such a long time, I can really see the sort of health, the public sector and the private sector all coming together now with some fantastic results and really innovative projects as well.
Projects like Wellness Action, run by local gym owner Trevor Seymour. He wanted to give back to his community and offer free charitable services to people who need them.
We found Trevor through a social prescribing link worker. I attended the main Huddersfield meeting for all the social prescribing link workers, and Rebecca just said, I've met this fab guy called Trevor and he's doing all this diabetes work.
And then the social prescriber said to me, how about creating a type 2 diabetes programme, as it were, and that's what I've done.
Everything fell into place, shall we say, and we had a bit of funding. We said, shall we do this as a pilot? We obviously worked with the PCN on it so that they refer people to it. We managed to get some funding together if people were struggling to travel as well. So we tried to remove every barrier that there was, and it's going fantastic.
So the way it works is they come here, we test their blood glucose, we test their cholesterol, the blood pressure, peak flow. So we do all those checks to start with. You're pre-diabetes.
Right.
Okay?
Right.
So we've got work to do.
Yeah.
People were getting sent here and we mentioned the word exercise, gym, all these things. It were like, no, stay away. So I thought, why don't we go food? Because people love food. Let's start talking about food. We give them a food diary, which is an opportunity to write down every single thing that they eat throughout the week. When they come back to the next meeting, we'll talk about that. And I can say, how can we improve that? So it might be a spoonful of sugar on the shreddies. Why do we need the sugar on the shreddies? You know, so if we can make some quick wins like that, we will help get their blood sugar down. And then every other week, we actually cook. So we go downstairs, they sit in the kitchen with me, and I'll make something like a spaghetti bolognese or a chili or a chicken tikka, but I'll make it in such a way that it's low fat, no sugar, no dairy, no gluten, and it will be healthy option food so they can go away and hopefully educate themselves and cook for themselves. We met a guy today who has actually got rid of type 2 diabetes, completely got rid of it. He had a knee operation and he wasn't able to exercise, so he had to eat better. He was eating too much sugar, he was drinking too much booze, he was doing all the wrong things. So he's really trimmed back on what he was eating, and he's now no longer type 2 diabetes, and he's lost the weight as well. So he's in great shape. I've now got a group of people that come in before the session, exercise, then come into the session. We've got one lady that was at the meeting today and she's lost 3 stone from the time that I met her. She's also got rid of her type 2 diabetes and she's not taking any medication. So I proved that this will work.
It's totally changed my life, basically. I've never been so fit. I'm practically running up the hill taking kids to school. So yeah, it's been a good thing, you know, for me. It is a lovely group. It's been great, it really has, and Trevor's brought out the confidence in me and he's helped me. He really has helped me and I owe him a lot.